Hello, my name is Canestra Bradley, and the topic that I have chose to speak to you all about today is preeclampsia. So what is preeclampsia? Preeclampsia is a condition of hypertension and protein in your urine, and it usually occurs around 20 weeks of pregnancy or 48 hours after you deliver your baby. Some other terms for preeclampsia are toxemia, pregnancy-induced hypertension, or gestational hypertension. Sometimes a woman may have high blood pressure before she's pregnant, and she may not know that she has it because she shows no signs or symptoms until she goes to the actual doctor and they test her protein, her urine, and do her vital signs. Across the globe, preeclampsia and other hypertension disorders of pregnancy are the leading cause of infant and maternal death. It accounts for 5 to 8% of all pregnancies, and it also is responsible for 76,000 maternal deaths and 150,000 infant deaths per year. So what's going on with the baby when you have preeclampsia? And what's happening is the placenta that we rely on to provide nutrients and oxygen to the baby, it's compromised when you have the preeclampsia. The baby's body, it starts to restrict the blood flow to the limbs, the kidneys, and the stomach area in order to preserve that oxygen to supply it to the brain and also to the heart. So when the O2 becomes depleted, the placenta dies or it separates, which is called abruptio placenta. And then the body starts letting off too much lactic acid, and then the baby becomes acidotic. And when they become acidotic, the baby, it becomes unconscious or it stops moving. So when this happens, the key is to either get the baby out or the mom risks having a stillbirth. Okay, so preeclampsia is divided into mild and severe, and with mild preeclampsia, your systolic blood pressure is 140 to 160 millimeters of hemoglobin, and in the severe, it's greater than 160. And with mild, in your diastolic, it's 90 to 100, and in your severe, it's greater than the 110, and I'm sorry, it's 110 for mild. Okay, so some other things that you'll start to see with mild versus preeclampsia is your urine output. Your urine output should be greater than 500 milliliters per 24 hours, but in the severe, you have less than that. So also, you'll have the protein in your urine. It should be less than 5 grams, and it is greater than 5 grams in the severe. Risk factors. Let's talk about the risk factors. I'm going to show a video in just a second that will talk about some of it, but I do want to highlight your history of preeclampsia. If you have a sister, an aunt, or a mom that has preeclampsia, then that places you at risk of having it as well. Age, anyone who is greater than 40 years of age is at risk for it. And obesity. Now, we all know that right now we're talking about the heart, and we're talking about cardiovascular disease and coronary artery diseases and that type of thing. When you're obese, you're at risk of having that condition. And so what it does is your arteries, they're narrowing, they're building with plaque, and it's causing your blood vessels to constrict, which makes your blood pressure, the blood harder to get through that artery, and so it's causing your blood pressure to rise. Intervals between pregnancies. If you have 2 children within 2 years, it's going to place you at risk. Or if you have a child now and you decide that 10 years later you want to have a child, then that's going to place you at risk as well. Multiples. It's hard enough as it is for those of us who've already had children for that blood to circulate through your body as well, because you have that extra human inside of you. So when you're carrying 2 or 3, that's going to make it even harder to get that blood flowing. And then a health history. So your health history, if you already have chronic high blood pressure, you're probably at risk, or you're going to have it anyway. If you have migraines, diabetes, kidney disease, or lupus. This is a video that's going to talk about the signs and the symptoms. Did you double click it? Go back. Double click in the middle where the lady is. That's okay. But anyway, what she's doing is she's just talking about preeclampsia, and she's pretty much going to tell you some of the same things that I've talked about. One of the main signs of preeclampsia is that you'll start to notice is you'll start to see a sudden weight gain. And this is when you start gaining a couple pounds within 1 to 2 days. You'll start noticing some edema in your face, your hands, your ankles, your hands, your face, in your legs, your feet, some edema. It may be pitting edema. And what it does is it's telling you that your body is holding on to fluid, so it's retaining it. Your blood pressure will be 140/90 or greater. You'll have some abdominal pain in your upper right quadrant area, and you'll also have some severe headaches, migraines. Those of you who have ever had a migraine, these symptoms go along with it. You'll have that blurred vision. You may see floaters. You'll have sensitivity to light. You don't want to smell anything. I don't know if I mentioned nausea or vomiting. Or you may not have any symptoms at all. So that's why it's always important that if you're pregnant to make sure that you keep your prenatal appointments. That way your blood pressure is monitored and your urine is checked each visit. Go ahead. Diagnoses. So across the board, of course, you're going to have your CBC, which is going to test for any infection, and you're also going to have your basic metabolic panel done, and what that's going to do is going to test your kidney function, your BUN, your creatinine, your electrolytes levels, if they're high, if they're low, if they're within normal range. The urinalysis, what it's going to do is it's going to give a ratio of the protein and the creatinine, and sometimes what you'll have to do is you'll have to have a 24-hour urine sample, which means you're going to have to urinate in a little container for 24 hours, take it to the lab, and it's going to test the protein in your urine, and that indicates the severity. You'll have a fetal ultrasound, and what that's going to do is it monitors your baby's growth, such as your weight and the amount of fluid that's in your uterus. You'll also have a non-stress test, and a lot of times when you have this non-stress test, you want the mom to be in a quiet environment. They're going to hook her up to a machine, and what it's going to do is going to detect the baby's reaction when it's moving to see if it has any stress going on, and it also do like kick counts to keep up with the baby. And then you also have biophysical profile. What that is, it's a combination of your non-stress test and an ultrasound together, and it tests like your breathing, the tone, the movement of the baby, and the volume of the fluid in the sac. Okay, optimum treatment is, of course, delivery of the baby. What we want to do is we want to, hopefully, we can treat the mom so that she can have a full-term delivery. If not so, by doing that, we'll give her medications. Some of the medications are your hypertensives, your labetalol. It can be given oral or it can be given via IV infusion. You also have Procardia and hydralazine, if I'm not mistaken. And that labetalol, what it is it's a beta blocker, and what it's going to do is it's going to open up those vessels so that blood can flow through easier. It's going to decrease your heart rate, and it's also going to decrease your blood pressure as well. And another thing that can go with that is magnesium sulfate, and what it does, it can decrease your blood pressure, and it can also help with the seizure activity, which I was going to get to with the anticonvulsants. And then you also have your corticosteroids, and what they do is they temporarily treat the preeclampsia and improve your liver and your platelet function, and it also helps to prolong your pregnancy. If the baby has to be born prematurely, the mom could get a shot of betamethasone, and what that's going to do is it's going to help mature the baby's lungs in 48 hours if born prematurely. You want to place the mom on bed rest. You want to make sure she has the appropriate IV fluids, and you also want to talk to her and monitor her sodium intake. So some nursing interventions that I found for preeclampsia are the fluid volume deficit, and that's going to be related to your fluid shift, which is going to be due to your edema, your weight gain, your decreased urine output, your nausea, your vomiting, your headaches, that sort of thing. You'll have decreased cardiac output, which could be related to your decreased venous return or your increased vascular resistance. You'll have altered tissue perfusion, which is in reference to your uteroplacental, and what it's dealing with your maternal hypovolemia and also premature delivery of the baby. Risk for maternal injury. I chose this one because with preeclampsia, the mom can go into convulsions where she'll start to have seizures, and you want to make sure if she has the seizures, I'm not sure of what type she may have, but you want to make sure that the mom is safe and everything is cleared from around her. Any loose clothing or anything like that is off or loosened. I'm sorry, tight clothing is loosened. And also with the edema, if it is pitting, making sure that they're not bumping into things because that could cause injury as well. Then you have risk for imbalanced nutrition less than your body requirements. So with this one, I chose this one because she may have nausea and vomiting due to the migraine headaches. So that could place her at risk for losing weight and that kind of thing. And then just knowledge deficit itself, not knowing that your blood pressure is up or what preeclampsia is altogether, because sometimes it doesn't show the signs and symptoms, and you may think that sometimes just some usual weight gain or some swelling in your legs or your feet, that's due to normal pregnancy, which it is, but you have to take it a step further. Okay. Some nursing interventions. Your daily weight, you want to monitor in case she is gaining the weight. You want to locate and measure the edema if it's pitting. Monitor your CBC and your BMP. Monitor the dietary intake. Like I said, you want to have less sodium. You want to monitor the I's and O's, making sure everything she takes in that she pretty much puts out as well. Monitor the vital signs. Keep track with that blood pressure and assessing those lung sounds for fluid. Schedule prenatal visits once every 2 weeks if the preeclampsia is mild, and if it's severe, you want them to come back every 2 weeks. You want to educate the patient on the signs and symptoms, and you also want to assess their knowledge to know what they know about the condition as well. You want to administer your hypertensives like your hydralazine, your labetalol, and your Procardia. Assess for any pain that she may have. Remember that pain is always what the patient says it is. Prepare for birth. In that case where she does have the abruptio placenta, you want to make sure that she is taken care of and that the baby gets out as soon as possible. Report signs of the abruptio placenta with the bleeding and the uterine pain and tenderness. Administer the anticonvulsants as needed. Calcium gluconate should always be ready when you're administering mag sulfate, because that is the antidote, and you also want to place her on seizure precautions. Outcomes. What do you expect with the treatment that you're given? What do you expect to happen to the patient, or what do you want to happen? You want the patient to be free of signs of generalized edema. You do want her to hopefully deliver a full-term baby. You want to make sure she is free of signs of the cerebral ischemia. Patient verbalizes her understanding and of her individual dietary need. You want the patient to display the appropriate weight gain needed for pregnancy, and you want her to verbalize her understanding of the disease process and the treatment plan. So let's talk about a question. Which is a risk factor of preeclampsia? Obesity, not bathing, choosing to have a vaginal delivery, or eating fresh fruit and vegetables? Right, A, obesity. Lab tests for preeclampsia are: select all that applies. Urinalysis, ultrasound, non-stress test, lack of exercise, or biophysical profile. Correct. And those are just some references. And that's it. Thank you.